This is Dr. Priya Ganesh Kumar, Medical Director of Sainivas Healthcare. This is a premium healthcare for preventive oncology, which is having a chain of preventive oncology centers pan India. Now, almost till date, we do have 35 mentorship chains under the Sainivas Healthcare. Now, we have been having a focused working on preventive oncology, especially on cervical cancers and breast cancer. Now, cervical cancer, as you all know, dear friends, has been considered as public health issue by WHO. And on 17th November 2020, there was a WHO call given by WHO for regarding cervical cancer elimination by 2030. And the elimination call had a slogan attached to it, say 90, 70, 90 adoption. That is 90% coverage of women, of girls below 15 years of age by HPV vaccination. 70% of women under the age group of 30 to 65 getting screened by high sensitive test, that is HPV test, at least twice in a lifetime, say 35 and 45 years. And 90% of women who have been detected with precancerous conditions being treated or cancerous condition being treated. So if this jargon is being adopted, this slogan is being rightly adopted, then at any given point of time, there will be less than 4 per 100,000 women of cervical cancer cases. So this is a speculation. And Sainivas Healthcare had this foresight right before in 2005 itself, because we understood at Sainivas Healthcare that cervical cancer being a public issue with a woman losing her life due to cervical cancer every 8 minutes in our country, and with 200 women losing their life daily, it is definitely there has to be a three-pronged approach for the cervical cancer control. So Sainivas Healthcare adopted this three-pronged approach way back in 2005 itself, and we started slowly developing ourselves. Today of what we are is actually has been laid, the foundation laid in 2005. So we worked with public into the rural Adivasi villages, into urban slums, holding a lot of camps, and in fact, treating them with our CSR funds, our own CSR funds. And this started with, starting the first center in Thane district, which was a state-of-art center for preventive oncology, the first of its kind in Thane district. Slowly, we reached out into Maharashtra. We spread our wings into Maharashtra. By the time we had started our teaching and training also. So this science, so the second approach being clinical, clinicians getting sensitized or upgrading the clinicians. So that was the second pronged approach. So with public, we had to sensitize our clinicians. So when we started our teaching training, which was Foxy accredited courses, we had already done more than 1,000. At that time, we realized that for it is not only the teaching and training, it is actually the hand holding. Beyond training, actually grooming them on their day-to-day case-based studies is what is the need of the hour. So we started our mentorship handholding programs, which actually empowers the clinicians, enriches them with the right knowledge. It does a capacity building. And moreover, it gives them that required confidence in doing the right approach, adopting the global guidelines, having the right recall system in a place, and treating these patients comfortably with an OPD based procedures rather than rushing into doing a hysterectomy. So our wings started increasing. There were a lot of people who started, adopting these mentorship programs. And today we do have 35 mentorship centers running globally, running pan India. And they have this reporting system. We do all the reporting system for them, of course, with their this thing, keeping them in a loop. And we have been generating this coded reporting system, so which is actually following all the guidelines and the latest guidelines for even treatment. So with this, we have almost touched more than 1.5 lakh women have been screening for breast cancers, for cervical cancers, more focused on cervical cancers. We have detected more than 50,000 precancerous conditions. We have treated them judiciously, perfectly by by the OPD-based LETS therapy, excisional therapies, ablative therapies like thermal and cryocoagulations, and we have prevented so many hysterectomies. We have given them the confidence for the public that there's no need for doing a hysterectomy for every simple reasons like white discharge. We have to go to the root and we have to find out the precancerous condition. We have to treat them so that you don't go into hysterectomy. Then from there onwards, when we started grooming ourselves in such a way, grooming the clinicians in such a way, there was the need generated for giving the right instrumentations to them, because unless and until there is a right correct instruments with you, the clinicians the work is not done well. So then we started, when we realized that there is a need for the right spec design instruments, we then started our Shrivari Medical Equipments, a private limited company, which is a sister concern of Sainivas Healthcare. So here we actually develop spec designed instruments, and few of the instruments are my own patency, and we have been able to help the clinicians who wants to groom themselves as preventive oncologists by giving them the right instruments. Again, there was a need for the right diagnostics also, to give them the right validated reporting system, validated HPV test, LBC test, mRNA, STI, pertaining to cervical cancers and pre-cancer. So we found out, we actually developed SNHC Diagnostics. Now, SNHC Diagnostics, we have a lab which is there in at Delhi. Our Delhi branch also started simultaneously. Now we have two centers, which is one Thane and one another branch at Delhi, where we have a lab which is again providing all the validated reports for HPV, LBC, and pertaining to then BRCA test, genetic test. So that's all pertaining to preventive oncology. So this lab is now able to provide its services across India. We have with the right pickup strategies and giving the reduced stack timing, and the doctors are very, very happy because they are able to trust the reporting system. The right reporting with the validated tests is very, very important when you are actually dealing with the patients. And then there was a need because then as our wings grew, as our the chains grew, and there were a lot of activities coming up. So we then found our Sainivas Charitable Trust. Now this trust is able to help the needy Adivasi villages. We are doing a lot of CSR activities under this trust activities, and we are able to reach the unreached masses. We are able to do the CSR activities of various corporates through this charitable fund, charitable system which we have, charitable trust which we have developed. So in this way, Sainivas Healthcare has truly groomed right from way back in 2000 to today being 2022. We have actually given this approach has been the approach has been centered towards mainly providing all the services under one roof. So a clinician, when they want to actually develop themselves as a preventive oncologist in their respective area, it is actually, they have to have this confidence that there is somewhere to fall back on, where there is a reporting system which is being generated, so they do not have to worry about the right or wrong reporting system, because there is a professional setting behind them to help them, to groom them, basically to enrich and empower them so that they become, and then they have the right instrumentation, they have the right the solutions, they have the right diagnostics, everything covered under one roof, the right ready reckoner. So we do have books into, my books are in like Atlas for colposcopy in preventive oncology, books in colposcopy in preventive oncology, which is there with the CBS publication. So there is also a ready reckoner. So in no way they have this lacunae or they have an uncertainty towards grooming or adopting preventive oncology as their main forte. So I'm very happy that this Sainivas Healthcare has has truly groomed these clinicians pan India. And today we are a family of 35 centers and doctors around. So on this day of 17 November, me as in the capacity of medical director of Sainivas Healthcare, I take a pledge and vow that our centers under the services of Sainivas Healthcare will be working in hand with the government, with WHO, so that the dream which the slogan or the speculation which WHO has brought for 2030 cervical cancer elimination by 2030, we will see to it that working shoulder by shoulder as a private sector, we would be able to achieve this dream. Thank you very much.